one is about the Toronto District School Board. So they are calling for an extension of the school year, an extension of the Christmas break after January. I know you guys have thought about it before. Where are we at with that?
Well, we've asked we have a table that's made up of public health people and education to look at some concepts around that. We've analyzed the data of what we see in Toronto, Peel, and around the province for that matter. So far, even if you take one of the schools that was a concern, Thorncliffe, the positivity rate in the children was 4%, in the community was 16%. So it would seem that sometimes children are safer in school than out of school at times. But we're still doing a lot of testing trying to understand that really well. The reports we have from our general ones that we don't have a lot of school closures and cases there. Our protection is pretty good coming in. High schools are a little bit different. They're mostly virtual. And usually once they get above the age of 14 or 12 or 14, they come to transmit a lot more just like adults. So they tend to do that, and there may be socializing going on that is not following total protocols out of school rather than in the school. So I think we'll review the matter. We know it's important to keep the children in this with the opportunity to have the education, and in the system it has to deal with both the students as well as administration and staffing. So it's challenging, I know, to run both a virtual and in class at the same time, and those are metrics and things that a group like Toronto District School Board has to deal with, along with the Minister of Education. I wouldn't want to comment on that per se.
But at this point, because they're relying on your recommendations, at this point, do you feel like it's necessary to extend the Christmas break beyond whatever it is, January 4th?
Well, that's still 3 weeks off to see what their data is going to be. And that's what we talked about the modeling today. Can we keep the numbers down? Can we stop it from growing? Can we even bring it down? And I think that's why we said it's so important. By bringing it down, you keep long-term care visitation going, you keep schools open, you keep the healthcare system from being compromised. So there's a lot to measure here for people not just to be casual. So we need those numbers down, because where we see the high community percentages, we see lots more kids showing up at school positive. We're doing our tests in schools. When we track it back, they seem to be getting it mostly all the time from family contacts back at home.
But do you know when we could make that decision? Because 3 weeks, parents need a lot of certainty, obviously, because it's going to impact them, right? Do you have an idea of when you would want to ideally make a decision?
Well, we'd have to see if, because we haven't seen, because I was asked the question earlier, is it contributing to school transmission? Yeah. And in-school transmission is not contributing. It's a matter of what does that mean? Because by having schools closed, remember, keep childcare too. You have to bring the two into account. That means some essential workers may not be able to go to work, and then we have concerns about healthcare workers. And because they say, well, if my children are not in school, then I can't get to the hospital to help out and whatever, or long-term care, et cetera, et cetera. So we have to weigh all those in. So I think obviously we're going to have to have an answer and a direction. At this time, we're still holding to open school as usual. After we haven't put it extended, but we wait to be informed by the Ministry of Education, by our data and information, by Toronto Public Health and by Peel to see where they stand. Because remember, they just lowered the metric for syndrome with only one to get tested. So you want to see what is the impact of that as well. So there's a lot of things on the move. So it's week by week, and we'll hope to give an update. Of course, we're going to have to give an update beforehand, so parents and school boards and teachers can plan accordingly. So there's a timeline. We'll try and stick to that, but we're going to have to look to our Ministry of Education, along with the board and Toronto Public Health and Peel.
Okay, and just briefly, one topic. A lot of business reporters, I think, are looking at this topic. You may have seen what the Hudsons Bay company is doing. They're basically going to court to see whether or not retail should be closed in a non-essential retail. I just wanted to get your thoughts on that. They're saying that the province doesn't have any evidence to really back up the closure of businesses or the distinction between essential and non-essential. Can you clarify that? Is there data to actually back up that businesses need to be closed during this lockdown, or the risk involved?
So I think as it pertains to the Bay, I'm not going to comment because now they put it into a court situation. So I'm not going to really comment too much on that situation there. What we have seen is over time, we do have outbreaks related. We have some in a retail. It's very difficult to document that when someone's in the store for an hour or 45 minutes walking around and then they leave, they're not sick right away. Therefore, they've done a number of activities for the last, for a day or two afterwards. They incubate 5 or 7 days. Do the member is exactly in that aisle of that store at that time? They have no idea. And that's one of our problems with our case contact, where people are going to, usually the ones that go to these centers, go from place to place to place. And it's very hard to attribute it because they're not only doing retail, they're going to restaurant, and they're socializing. So which one was it? And all you need is one super spreader in the place, and you have a problem.
So it's the risk, not the reality.
It's the risk. And that's what we're saying. If you're in a congregate setting, because a lot of people are going into some centers like restaurants, you can't have a mask on and eat. And retail stores, at the same time, a lot of people are not maintaining that. If you have a positivity rate over 5%, that means if you're in a group area space with 10 people, there's 80% chance someone's incubating and transmitting. If you're in a store with 50 to 60 people, and some people I watch, the mask is down around the bottom of the nose, they're standing there talking, and someone will come up and saying, lean in your face and say, do you know where the so-and-so is on the shelf? And saying, what are you doing? And I've listened to some people saying, they're going in the aisles in the grocery store even saying, you're going the wrong way. It's that way. Well, I want to go this way. Don't you see the arrow? Go that way. And so people are just not sticking to the rules. But then if you're in close contact and your positivity is high, there's a good chance that a person you thought was not infected is right there spreading. So the more you congregate people together, the more you get them out and around, the more in close contact. Because we say the masking and distancing, like you're walking on the street to go buy someone. That's one thing. If you're in a store, and I've seen people like right next to each other talking and discussing what they're buying, it's just asking for opportunity. So it's the risk behavior. And that risk behavior, even if you're not in the lockdown red zones, it's still risk behavior. And if you're out in the yellow and orange, it's still the same thing. The risk behavior should not be taken, and you should minimize those contacts. So it's the risk behavior that's the issue. We don't go around testing everybody who walks out of a retail store because they're just starting to just contract it. It takes 5 to 7 days before they would see if it's positive. And that's one of our problems with our case contact management. Some of those people do the same thing. They have so many contacts in places, it's very hard to track it.
Okay, perfect.